I want to talk to you about one of the real common mistakes that you can make as a clinical supervisor. The mistake is that you talk with Tom or Sarah about Mrs. Jones, and you spend a good chunk of time, 20 minutes, 30 minutes, talking about Mrs. Jones, her life, where does she get stuck, what's her diagnosis, about her history. This is not clinical supervision. Clinical supervision is not you and Tom talking about Mrs. Jones. Clinical supervision is about you helping Tom talk to Mrs. Jones about her life. Your job as a supervisor is to find out where Tom gets stuck doing therapy with Mrs. Jones. It is not about spending time talking about Mrs. Jones. But this is an easy trap to fall into. And generally there's three sources for this. One is that you're a brand new supervisor. And if you're a brand new supervisor and you are not comfortable yet in being a supervisor and don't have supervisory skills, it's easy for you to go back into your comfort zone. Your comfort zone is going to be doing clinical work, and essentially what you're doing and what you wind up doing is you do remote control clinical work. Rather than talking to Tom about Mrs. Jones, you tell Tom what to do with Mrs. Jones, or you decide to talk about her instead of talking about Tom. The other reason you may get stuck is because your leadership style tends to be a little bit controlling. It's what I call the drill sergeant person. If you get anxious about people making mistakes, if you feel like you need to have control over what people are doing, you can fall into this role where you tell people what to do. The problem here is now they don't develop their own skills. They don't learn to think for themselves. They become dependent on you, and they don't become creative. So you don't want to do that. And finally, the place where you get stuck is the nature of clinical supervision should be about what's happening in the room. It should be about your relationship with Tom. It should be about where Tom struggles and gets stuck in his skills and knowledge in helping Mrs. Jones. These can be difficult kind of conversations because you have to step up and approach your anxiety, and what happens if you just spend your time talking about Mrs. Jones is you bind it. You and Tom collude not to talk about your relationship or talk about him. My point is, don't do this. This is not clinical supervision. This is not going to help people to grow. So think about how you do clinical supervision. Think about how you need and what you need to focus on when you see Tom or Sarah this week and help them figure out what they need to do to think better, to act more clearly, to be a better clinician. Let me know what you think about this. Put your comments on the bottom of the page. Thanks.